7,100 new COVID-19 cases today. That is the highest single-day jump since the onset of the pandemic. And that has prompted the Okta research team to propose putting the National Capital Region under a hard lockdown. Russia's Gamaleya becomes the fourth pharmaceutical company to secure an emergency use authorization in the Philippines. Metro Manila mayors have agreed to tone down Holy Week activities this year. And in lighter news, a marine scientist from the University of the Philippines is set to become the first Filipino to reach the third deepest spot on Earth. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Sean Yao. The Health Department recorded 7,100 new COVID-19 cases today, the highest single-day jump since the onset of the pandemic. San Lazaro Hospital Infectious Diseases Head, Dr. Ronjean Solante, joins us live to give us his insights. Dr. Solante, let's start off with your reaction to today's case count.
Well, that's really alarming because from 5,000, then we have now 7,000, and that can really be a problem now among hospitals. We're beginning to feel the cases that has been admitted in our hospitals, both private and public or government hospitals.
That's right. We've all heard the reports. So at this point, Dr. Solante, should the government implement stricter protocols like ECQ perhaps as brought forth by Okta? They're suggesting a hard lockdown for NCR. Does this spike warrant that drastic measure?
Yeah, I think the government now should look into this. No, the cases now is more or less higher than what we experienced before in last year's July or August. So this is the highest, and we don't want this to escalate more in the next 2 to 3 days because that will really overwhelm our healthcare facilities.
All right, at this level, 7,100 cases, how long do you think before we overwhelm our healthcare facilities?
It depends on the current distribution now of cases that are admitted because as we always know, when you look at 7,100, like 3 or 4% of these are in the moderate to severe, then if half of this is in Metro Manila, then I would say a lot of these hospitals now are more or less above the capacity of the allotted beds for COVID-19.
That's right. But in spite of us reaching this capacity, a lot of other health experts have also told us they are more equipped to handle this caseload now, or at least COVID-19 cases now a year into the pandemic. Will this in any way kind of better help hospitals and healthcare workers to manage the spike?
It may more or less help us, but it doesn't, meaning if you have like your bed capacity is 150 and you're handling 200 cases and half of these are critical, even if you know how to manage, it will still boil down to the fatigue and burnout of healthcare workers manning a 200 patients, but the capacity is only like 150.
That's right. And all this, Doc, is happening as we are almost running out of on-hand stocks of vaccines. Having said that, are you in favor of Health Secretary Duque's proposal to divert the vaccines from low-risk areas to COVID-19 hotspots, in this case, of course, the NCR?
Yeah, that makes sense because in an area where there is high risk of transmission, then we have to prioritize the vaccine, especially given the premise that our vaccine is limited. So in this limited supply of vaccine, then I think it makes sense to allocate the vaccines to this high-risk area, protecting our healthcare unit members, the facilities that are taken care of by the healthcare workers. So I would agree with that.
All right, and Dr. Solante, before we let you go, any other recommendations to prevent a further uptick in cases during the Holy Week celebrations? Understandably, a lot of people might be staying home, but a lot of transmissions happen within homes. How do we self-manage ourselves this coming Holy Week?
So we always imply that even if at your home and then you have mild symptoms, you always have to inform your barangay if you have symptoms. Testing is very important at this point in time because we don't want to let anybody be symptomatic, even the mildest symptoms, and exposing your relatives, your vulnerable high-risk parents or grandparents, that will make them be the ones that will be admitted in hospitals.
All right, thank you so much for your time, Dr. Ronjean Solante, Infectious Diseases Head of San Lazaro Hospital. Thank you, Doc.
Thank you.
And today's 7,100 new COVID-19 infections brought the total caseload to 648,000. And of this number, around 73,200 are still considered active cases. The death toll now stands at above 12,900 after 13 more COVID-19 patients passed away overnight. Meanwhile, 390 new survivors were logged in the last 24 hours, bringing the total number of recoveries to 561,900. The Octo Research Group projects that Metro Manila will see 4,000 to 5,000 new daily cases by the end of March. The group also warns that hospital occupancy in the NCR may reach 80% if the current trend continues. And all AstraZeneca shots that are on hand will now be administered to cover more healthcare workers despite uncertainties on the arrival of the next shipment. Greg Gregorio with the report.
At least 4 brands of COVID-19 vaccine may now be deployed in the Philippines for emergency use after the Food and Drug Administration approved the application of Russia's Gamaleya for its Sputnik V shot. Based on available data, the 2-dose vaccine has an overall efficacy rate of 91.6%.
After a rigorous and thorough review, the FDA is granting emergency use authorization to the Sputnik V GamCovac.
10 to 15 million Sputnik V doses are part of the government's vaccination pipeline. Of the number, Vaccine Czar Carlito Galvez says some 2 million jabs may already arrive in the country as early as next month. Sputnik V, along with that of Pfizer and AstraZeneca, is recommended for use among senior citizens. Authorities are also waiting for Sinovac to provide more data for elderly use.
Sa ngayon nakikita po natin na medyo mahina po yung side effects o may tinatawag ng very mild side effects ng Sinovac. Nakikita po natin na baka pwede po rin po talagang gamitin po ito sa mga seniors.
Meanwhile, the government and the private sector have secured 20 million doses of vaccine from Moderna, some 13 million of which will go to the government inventory, and the remaining will be for the private sector.
Ang dating nun, ang earliest naman po namin, nag-negotiate po kami, na may po darating po siguro more or less mga 300,000.
For now, the earliest arrival of additional shots is expected on March 24, around 400,000 jabs donated by Sinovac. Another 1 million doses procured from the Chinese vaccine manufacturer are set to arrive on March 28. Meanwhile, some 900,000 more AstraZeneca jabs from the COVAX facility are tentatively scheduled to be delivered next week. In the meantime, President Duterte authorized the use of all AstraZeneca shots as first dose for healthcare workers.
The President has approved the request to utilize all on-hand COVAX donated AstraZeneca vaccine doses as first dose vaccination in order to protect a larger number of frontline healthcare workers.
The recommendation came from various officials, including Galvez and Health Chief Francisco Duque III. For News 5, Greg Gregorio, we are One News.
We have more stories after this quick break. Stay with us. You are still watching One News Now. I'm Sean Yao. Pork producers want the president to increase the contingency fund by 20-fold once the government declares a state of emergency because of the African swine fever. Shyla Francisco has the story.
Pork prices in Kalayaan Talipapa market have reached 330 to 360 pesos per kilo now. This is similar to major markets across Metro Manila where pork prices are all beyond the price ceiling. This is why some retailers support the Agriculture Department's recommendation to President Duterte to declare a state of national emergency due to the African swine fever.
Doon sa amin na kinukuha ng baboy namin, yun talagang magmura para magmura din kami dito. Mahirap pa yung buhay pati ngayon. Saka mahirap din maghanap trabaho na ngayon.
Under the DA's draft proclamation, a 1 million peso contingency fund will be allocated in the initial implementation of the state of national emergency. But as early as now, pork producers are urging President Duterte to increase it to 20 billion pesos.
Abot yan ng 8.5 billion. Hindi pa kasama yung libreng test kit, yung subsidy para sa ating mga backyard racers na yung tinamaan na, at yung repopulation. Then humanap ng pondo. Meron naman tayong pondo sa Taripa.
The DA says the amount they propose could still go higher depending on Duterte's decision. Meanwhile, some pork producers are concerned that the country may see a new variant of ASF. This is after the DA said it will test 2 locally developed antiviral compounds which are reported to be effective against ASF. They said we might see a similar situation with China where various variants were found due to illegal vaccine use.
Sabay kung magte-testing sila, huwag doon sa mga backyard racer. Wala na nga puhunan yun eh, yung pang-uunahin mo. Ba't hindi ka bumili ng baboy at testingin mo sa farm ng Department of Agriculture, dyan sa kanilang farm. At pagkasigurado ng effective yan, saka nila gawin sa aming mga magbababoy.
But the DA assured the safety of the compounds, which the agency said were properly tested in various farms. The DA says trials for the compounds may start in 1 to 2 weeks. Shaila Francisco, We Are One News.
Here are other stories we're keeping our eyes on. NCR mayors agreed to limit Holy Week activities amid the surge in COVID-19 cases. Seating capacity in churches will remain at 50%, but processions and other Holy Week celebrations will not be allowed. The government has revised its travel restrictions for inbound passengers. The National Task Force Against COVID-19 has allowed the entry of all Filipino citizens, including non-migrant workers, starting March 22 until April 21. They will still be subject to the arrival quota of only 1,500 international arrivals daily. And Boracay approves the use of saliva testing instead of nasal and throat swabbing tests for tourists who plan to enter the island. But the Boracay IATF clarifies it will only accept saliva test results from the Philippine Red Cross and other laboratories that are accredited by the Health Department and the Food and Drug Administration. And for some light news, a marine scientist from the University of the Philippines is set to become the first Filipino to reach the 3rd deepest spot on Earth. Dr. Deo Florence Onda is part of an expedition to explore the Emden Deep, located in the Philippine Trench from March 22 to 28. Onda was invited by private company Caladan Oceania and will be joined by American explorer Victor Vescovo. Onda and the crew will stay in the area for 2 to 3 hours. It will take about 8 hours in total to submerge and emerge from the Emden Deep.
It's time for us to further expand our knowledge about our seas by going into the Philippine Trench and going deep into the Philippine Trench, going deep into the Emden Deep.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.